this is the examination of the knee, and most of what we do, we like to do by palpation as well, in addition to looking at x-rays and MRIs, in order to find things that an x-ray MRI wouldn't show. Now, I'm not going to lay the patient down and put her through some of the other maneuvers, because I don't think that it's necessary just for the purpose of this demonstration. This is something that we do for our patients on an everyday basis. And this is something very common here, that we see weakness in the insertion of the medial collateral ligament, but it often does not show up on MRI. The medial collateral ligament is so important because it supports the inside portion of the knee, and as it gets weak, the inside starts to wear, and then that accelerates arthritis. Usually for most patients, they have more arthritis in the medial compartment compared to the lateral compartment. As we can see here, the patient has a little bit of swelling and bony deformity, and we're going to perform a stem cell procedure, and you're going to see how we do this in order to help with her symptoms of arthritis.